Hello friends, today we are going to discuss about COVID grief counseling. I am Dr. Suresh Padmathat, Professor of Psychiatry, working at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic and training purpose only. For clinical opinion, please do contact a psychiatrist. Conflict of interest? None. Death may end a life, but not necessarily a relationship. The objective of this video is, during death, how to accept the reality of loss, handling the pain of grief, adjusting to the life without the deceased, maintaining connection with the person who is no more, getting back to normal functioning. So these are the 5 important objectives to achieve in this video. So we will learn this by watching this video. Grief. Grief is an emotional, behavioral, cognitive, and functional response to any loss. But in this video, I'm going to talk with regard to death, that is, loss because of death, and how the people respond to this grief. A normal response to any loss, such as job, finance, relationship, dreams falling apart, health, and life. So these are the grief which occurs for various reasons. But remember, grief is universal and it is normal. No need to pathologize all grief. There are certain times when the people may require support and help to overcome the grief response. Each person's response to grief is unique, complex, and it is very personal. So, dealing with grief differs from person to person. At the same time, you need to know most of the grief responses resolves on its own, as a normal course and time frame to resolve. It doesn't require professional help in most of the situation. Family, friends, and relatives help in this healing process of grief. The professional requirement is hardly 10%. Please do encourage the last rites and rituals so that the healing process becomes fast. At the same time, taps into the individual's potential to deal with their own loss. That means you need to help them to overcome their grief so that they get empowered. Next time, whenever there is such loss, they learn to deal with that, experiences what you have taught to them. There are various ways the people respond. Let's understand what are the different factors which play a role how a person responds to a grief. There are 2 important. One is internal factors, another one is external factors. Internal factors are those within the human being. External is outside the human being. The internal factors are basically coping skills, attachment to the loss, that is the person who has died, sense of responsibility. What was my responsibility for his death? I did not take him to the hospital in time. I did not give enough of attention. I did not get the medicine. I ignored him. That sense of responsibility and the guilt plays a very essential role in grief. Pre-existing mental illness. A person who is grieving has already depression. This grief is going to worsen. Spiritual belief also plays an essential role with regard to internal factors, how they respond to grief. Let's discuss about the external factors. The timing of the death. Was it unnatural, natural? How it happened? The way the family and social support around the person who is grieving. Dependency of the person on the deceased. Reason for death. Context of death. Expected or unexpected death. These are the various external factors also play in shaping the response for a grief. Let's move further. Let's now enter into the grief counseling. So the grief counseling depends upon various stages. You should know that. Elizabeth Kübler-Ross gave stages of grief. She wrote a book which was released in 1969 titled as On Death and Dying. According to Kübler-Ross, there are 5 important stages of grief. As soon as a person receives a loss, there will be shock and denial. Example, if a person is diagnosed to be suffering from COVID, or when a person hears a loved one has died, there will be shock and denial. And then immediately there will be an anger against that person, or else anger against self or against the environment. How can he leave me? What did I do? And I did not take care of him. The hospital was responsible. The blame, that anger starts, sometimes inwards, sometimes outwards. The third one is bargaining. Okay, I can't do anything now. So that bargaining with the maybe so-called God, telling that give me one more day so that I can stay with him, wish that time with him. Or they may even ask that I will pay this much to the temple, or else offering to the church or to the mosque or to the poor, so that I can have some time with the deceased. That bargaining process starts. The next is depression, and finally is acceptance. So if you know the stages of this grief, you'll be able to learn how to deal the stages and take them, go through this process. Many a time, these 1 to 5 steps may not occur in the right way. Sometimes the person, as soon as he realizes there is a death, he may go into depression, or else he may not show any signs of grief at all. So this, although the steps, but unfortunately human being is complex. Hence, sometimes the mixture of steps also can occur in the same person, same time, or in varying time. Let's understand how the stages of grief occurs. If you take on x-axis the duration in weeks, and on y-axis is the emotions. As soon as there is a loss occurs, immediately the emotions rises up. There is shock, there will be numbing, and then there will be denial. Once this occurs, invariably there will be anger, and then bargaining starts, and then the depression, and then the acceptance. So this is over a period of 2 to 3 weeks or 5 weeks, invariably most of them overcome the grief, and then they bounce back and they go back to functionality. This is common in every grief. So this occurs even in Indian scenario. That is the reason within 2 weeks after the death, the invariably rituals are carried out. So that's the same 2 weeks time is taken for a person to come back. So the people come together, grieve, and they let go that person, the life goes on. Let's understand the complicated grief. The complicated grief, here is the normal grief, now exploding grief. The person becomes so angry, he may attempt to kill himself or kill other person, thinking that person is responsible for the death of his loved one. Or else there will be no grief at all, complete absent. Other one is delayed. The person has died. After 2 weeks or 3 weeks, the grief starts in. So that is delayed grief. Another one is protracted grief. The grief continues for years on, maybe months. So that kind of is considered as protracted grief. But sometimes there is oscillating grief. The grief moves up and down without even knowing on which stage they are going through. So these are the various complicated grief. Let's understand how the complicated griefs are seen. Invariably, emotions consisted of confusion, disorientation, sadness, feeling of overwhelmed, shock, anger, detached, disoriented, numbness, irritability, frustration, agitation, fear, and so forth. So these are the emotions seen in a very high quality and quantity in complicated grief. Cognitions, denial of death, feeling of helplessness, hopelessness, worthlessness, feeling responsible, that I am responsible for the death. I am useless. It is my fault. My father died. No future. Better I will also join the person who has died. Suicidal self-harm thoughts, and world is not a good place. Better to die. So these are the various thought process starts running. Sometimes they become highly philosophical. The behavior will be suicidal attempt, self-harm behavior, drugs and alcohol use, breaking COVID protocol, not wearing mask, going outside, becoming aggressive, fighting with everyone, avoidance, avoiding to talk about the person who has deceased. Now the question is when to seek help. This is a very important thing to know, when to refer a person who is going through a grief to a mental health professional. 90% do not require any help. Support from family, support from relatives, friends is more than enough. The 10% have severe complicated grief. They require counseling, require of counselor's help. Seeking help for grief is usually the signs and symptoms are denial of death. They feel that he's here. I saw him just now. He's in that room. So that kind of denial is seen. Suicidal attempt, death by suicide, severe attempt, protracted emotional turmoil lasting for long days, poor biological and functional recovery. The person does not sleep, does not show emotion, does not interact with anyone even after 2 to 3 weeks, anger, anger outburst, irritability, violence, depression. So these are the various signs and symptoms which is different from normal grieving process, may require help. Let's understand why this COVID grief is unique. Because grief is there since since the humanity is there. How is it different? Uniqueness of this COVID grief is it is common to everyone, but the experience is unique to everyone. Death in isolation, rapid death or unexpected death, the minimal rituals. Earlier, if there is a death, the ritual used to occur, they used to see the face. But in COVID, there is no rituals. Seeing face is very minimal. The last moment is not spent with the person who is deceased. Social and relatives distancing, not able to say goodbye, no dignified burial or funeral, social stigma and discrimination. When there is a death in the house, even the neighbors and the locality people do not allow to bring the body there. So this kind of situation was not seen earlier. Along with this, survivor's guilt, helplessness. I could not do anything to my family member. My dad, I could not do anything. Source of infection. If the person feels that he has transmitted the infection to his father or mother who died. I was there. I was not there to help them. They were admitted in the ward alone. And no information before death. Suddenly they got the news. Availability of resources. They will be angry. The vaccine was not given to them. Oxygen was not given. Treatment was not given in time. The bed was not available. Hospital did not admitted them in the time because of the lack of resources. That anger. Was it preventable? It is. Did not do something. It's like this. They did not seek help. Telling his dad, telling that, okay, we will see after 2 days. By the time 2 days reached, the father deteriorated and died. So not doing something, not seeking help early, refusing something, did something like refusing not to take vaccine, telling that vaccine is not safe. Later he came to know vaccine would have saved him. So this kind of thoughts starts coming up. At the same time, they also start imagining what was his last moments, how he would have suffered, how he would have had difficulty in breathing, who helped him. At the same time, conflict with the deceased regarding the COVID protocol. The person would have said no need to wear mask, or else told him not to go out, not to go to the relatives, not to go to the function. The person broke the protocol. So those kinds of conflicts, fighting with the deceased before and during hospitalization. The person will be very, very angry with him because he has got COVID or he's got fever. Now I have to take care of him. That kind of anger would have been shown to take him to the hospital during lockdown or going and negotiating in the hospital for the minimal resources like availability of bed. At the same time, survivor guilt also seen is fear of getting infected and dying. The father has got, now I may get, my child may get, my wife might get. Stigma, discrimination, being afraid of that, fear of death in the other family members. Pre-COVID relationship plays a very important role. For example, the person who deceased, and the person who is grieving would have not spoken to them for years, and that may start playing now. So, in this background of COVID grief, counseling challenges also are very high. For example, earlier death used to unite. That means everybody used to come, relatives, friends, even the enemies used to come to grief. But now, in COVID, nobody comes when there is a death. So that means there is no group rituals or group grieving doesn't occur. What are the challenges now? At this point of time, in person grief therapy is not there. In person ritual or funeral is not occurring. Planned session for therapy may not occur. Paucity of time, maybe having 1 or 2 sessions. Availability of other family members, friends, and relatives to support is not available. Further, these kinds of things may worsen grief. Now let's jump into what are the steps of counseling in grief. First and the foremost, virtual funeral services can be arranged. If a person has died, nowadays virtual services are available. Using social media platform can be connecting the family members because there are protocols when the funeral is done. They cannot have more than 10 people. So other family members, friends, and other members wants to join can be allowed to join through social media or by virtual platform. So the people can be given a choice to join through virtual mode so that the grieving occurs collectively on virtual mode. The first and the foremost, if the counseling services is started, introducing that is basically rapport building, introducing demographic details, you can start telling that, is there anything bothering you now? How can I help you? So these are the rapport building questions can be asked. Second, directly talk about the deceased. What was the relationship? How was the relationship? What are the last activities done? What are the best time you spent with him? When was the last time you fought with him? So those quality time can be started discussion so that the emotion starts coming out. Talking about the circumstances of the disease, how it happened, when it happened, where it happened, when he came to know, how did he react? Ask about whether he is feeling responsible for the death of his beloved one, or else he is blaming someone else. He is angry about the doctor, nurse, hospital, or the other brother or the siblings, about the other family members who did not take him to the hospital at the right time. So these kind of questions to be probed in at the third step. Facilitating ventilation, allowing the person to express his emotions, active listening, supportive work to be done, inquiring about the emotions, and also paraphrasing. Inquiring about emotions means, tell me what happened, how did you feel at that time? What was your thoughts running at that time? What was the emotions which predominantly prevailed during that time? Paraphrasing, you said that you felt very angry. That's what I understood. Is it so? What made you to feel angry? So that kind of paraphrasing and also bringing the emotional words to understand what he felt plays a very essential role in facilitating of ventilation and also expressing empathy. And also at the same time, we should learn to normalize the emotions of grief because grief is universal. Every person will grieve in their own way and in a different way, and every person's coping skill is different. So you need to tell emotional reactions are natural and normal and to be expected. Even if I'm in your place, I'm going to have the same reaction. So those kinds of words will normalize, validate the emotions. Yes, anybody in your place may feel that they are responsible for the death of their loved ones. Let's analyze individually. But that validation is very essential because the feeling of guilt may carry for life. So you need to neutralize at the earliest. At the same time, a person may also feel that he may be going crazy. He may feel he's be losing his mind. He's losing his control over his mind. But you need to say, okay, this is normal reaction, normal emotional response. You're not going crazy. So those are the important words need to be communicated as many times so that the person's cognitive restructuring occurs. He is feeling normal emotions, normal, responsible emotions. Feeling guilty is normal. So those kinds of things has to be validated. Follow up. If the person may not be able to come for follow up grief therapy, you may have to call him up, ask him how is he doing. At the same time, you may also can consider giving homework assignments such as writing diary, writing letter to the deceased, routine work, structuring the whole day, planning immediately what can be done next. Sometimes symbolic rituals can be carried out if he has not attended the funeral. Let's understand which are the homework assignments. Symbolic rituals by the loved ones can be encouraged. The family members can get together, can keep the person who has deceased photo and grieve, allowing them to talk about the person who has died. What was their feeling and what was the last time they spoke to him? Those kinds of discussion can be carried out. Open chair technique can be done. You can call the person who is grieving and he says he is feeling guilt. You can ask him to say sorry to a chair and you can tell him that his father is the person who has died. Maybe his father is sitting there on the chair. Now you can talk to him and say sorry. Sometimes that kind of saying sorry, what happened, those can be one of the way of venting out. Sometimes role play. Suppose if your dad was sitting there, can you become his dad, like taking the role of the dad, and what would have he said to his son? So those kinds of role play will help him to get out of the emotional blocking which has occurred or emotional which has been kept in his mind. Using photo albums, asking how the photo was taken, when it was taken, what was the expression at that time. Watching the videos of the deceased, like recent trip, those kinds of can bring in the emotion and ventilation. Writing letter to the deceased also is very essential. Sometimes people may not be able to express. They can write and they may not post it. So that kind of writing letter also relieves the emotions which are pent up inside the mind. Using art. Some people may be good at dancing or drawing. So those kind of also can be used to express their emotions. Do something in the honor of the deceased. Imagine the deceased wanted to give some money or donation to the poor people. So that can be continued. If the deceased wanted to go for pilgrimage, in his name, the person who is grieving can carry out. If the person who has deceased has a dream to achieve, that can be now the person who is grieving can be carried out. And also completing the unfinished task of the deceased may become one of the important goals so that he starts doing those things. To come to the last part of my presentation, let's have some tips for grief therapy. First and the foremost, as a therapist, you should have to know what is active listening, allowing to express emotion. Don't stop them by crying or becoming angry. Don't stop them. Normalize the emotion. Validate their emotion, telling that, yes, this is common. I've seen these kinds of response by other survivors. Validate the survivor's feeling, encouraging the grieving process by having symbolic rituals, symbolic funerals. Grieve with the family members, not to grieve alone. He can call his family members, loved people, they can talk about the deceased and they can grieve. Structure the daily activities. This is very essential in the early part of the grieving process. These are the don'ts. Never block emotions of a person who is grieving. Don't tell, stop crying. That is wrong. Don't preach, telling that you are be strong, don't be a weak person. No, every person need to grieve because there is a loss. The grieving is the normal response to a loss. So the person need not be strong and keeping a bold face. Forget the deceased. It is simply impossible. They still remain in their memories, in their thoughts, in their feelings. Stop talking about the deceased. That still simply cannot. The more you block, the more it comes back. Hence, let going is the best way. Avoiding discussion. Don't do that. Please discuss about the loved one. Discuss about the person who has departed. Talk about him. The more you talk, the easier it becomes the life, and they learn to deal the life without him in reality, but they still remain in the thoughts and feelings. To my last slide, my dear friends, the only cure for grief is to grieve. Don't stop grieving. Thank you very much for giving your valuable time. Stay safe.